We recognize that for some general practitioners or family doctors, applying for the exemption just becomes another barrier for them, let's say, and oftentimes they just don't have the time.
So the health minister is slashing red tape, removing the need for that exemption, and boosting funding. The changes would also affect prescription heroin, something you'd normally have to go to a hospital to get. The minister says that needs to be more readily available in the community. And as Susan Lunn shows us, those on the front lines agree.
They get their clean supplies. We have needles, ties, cookers.
This supervised drug injection site opened last fall. Since then, staff have overseen up to 250 injections a day.
I was surprised. I didn't realize that it was such a big problem, that there was such a large amount of people that were coming in and using. I didn't realize that people were using like up to 5 times a day, if not more.
People who come here can get more than clean supplies.
Then we have a little relaxation area where we're able to connect with our clients and speak to them about different options that they might be wanting to talk to us about.
One of those options is a program that gives people clean opioids to replace street drugs.
It saved my life. It saved my life because I died twice.
Ricky Belanger used to live on these streets. She was one of the first people to go into the program 7 months ago.
So since I've been on that program, I've been an overdose, and like I said, I don't do any other drugs, you know? I follow my program.
That program has so far had to use the opioid Dilaudid because there are no restrictions to prescribe it. Under the new federal rules, methadone will be easier to prescribe. Prescription heroin will also become an option.
There are differences, and we'll be able to select, when appropriate, the right medication.
The government is also spending nearly $19 million to deal with the prejudice people face when they have an addiction, a problem Davidson sees all the time.
When we first opened, we've seen the effects then because people were a bit hesitant to come talk to us about whatever issues they're dealing with.
Countering those negative attitudes, Davison says, will bring even more people here to get the help they need. Susan Lunn, CBC News, Ottawa.
So just how many Canadians are taking methadone? Well, according to the stats, the numbers are soaring, at least in Ontario. The number of patients has jumped to more than 50,000. That's 16 times higher than it was 20 years ago. But get this. More than half of that methadone is prescribed by just 57 doctors. And that raises questions about how that treatment's being spread out. They'd like to see more doctors offering more treatment options.